Welcome to Horse Vet, a new series about horses and the veterinarians who care for them. Our first story is about Rosie, a 20-year-old mare who's having a seizure, a rare occurrence in horses. Let's listen as Dr. John Newcomb talks to Rosie's owners.
The difficult part about seizures in horses is that even if you can kind of say, hey, this is where I think it's coming from, trying to control them is very difficult. And it's not something we do in the field. Not at all. I mean, we don't carry the drugs, the phenobarbital or Valium or anything like that to treat seizures in a horse in the field. We just don't do it. It's not something you see in the field. She might go through this for a day or so, and then things might be quieted down since we're not really knowing what causing it. Obviously, seizures and change in brainwave electricity or electrical activity. There's all kinds of possible options as far as causes, and you know, it's just, I would be guessing to try to pinpoint what's going on with her. It becomes a real difficult scenario, and where I kind of draw the line is when they start becoming unsafe for us to handle or be around, or unsafe for herself, because we don't want to see her hurt herself. If she continues to have this activity, this abnormal activity where she's going to be hurting herself, then it's not really fair to her without doing something for her. Seizures in a horse are so rare that we just don't even worry about carrying medication for them. First of all the medication required is this very restricted medication, and it's just such a hassle to try to carry stuff like that. It's just not worth it to us, and we never see them. And as soon as we see them, boy, those things are hospitalized immediately so they can be monitored around the clock, you know, every minute of the night. I try to let the horse kind of determine its own destiny a little bit. If they get worse, then it's a really easy solution. They've told you what needs to be done. You know, you need to put them down. If they get better and they're doing okay, then maybe there's a remote chance that she could be okay. Euthanasia is very humane as well, if you've never been through that. So she hasn't had any episodes that we know of in the last, well, basically like 36 hours, Saturday night. She's pretty quiet and peaceful right now. This morning she's pretty relaxed and just pretty much walking around in a normal manner. Everything seems pretty normal. She's sure listening to the left, huh? Interesting. Well, she's still using her ears. She kind of acts like she's a little bit aware of what's going on around her. The whole time she's been wanting to go to the right, cock that head to the right. What I observed that one evening, you know, after this, that evening, but yet they never turned anything severe. Just the head twitches. My impression of the video is that the mare obviously has an acute neurological abnormality. Origin of it, it looks like it does involve the facial nerves to some extent, but obviously involves her balance and locomotion as well. So there's more than one location, so it would be a difficult scenario to try to pinpoint what the problem is without doing some very involved diagnostics, CT scan, x-rays, etc. No gross evidence of trauma, so I'm not convinced that there's a trauma episode, so things you have to be concerned about are obviously viral abnormalities as well as infections. The video reconfirms the fact that it's a very serious abnormality. I had not seen any evidence of the severity of her problem prior to this, so it definitely changes my perspective as far as how serious it can get and how dangerous it can get for both the horse and maybe a handler. So it basically reconfirms that we have a serious abnormality that if the owner isn't willing to pursue any diagnostics, probably the best option for the mare, long-term and short-term, would be euthanasia. She could easily hurt herself, break a leg, head trauma, neck trauma. It could definitely be life-threatening to her from other standpoints besides just the neurological issues. And obviously a person could get hurt handling her as well. We'll get some sedation drawn up and the euthanasia solution. And do the only bad thing that we have to do once in a while. I shouldn't say bad thing, it's a good thing in that sense, but you feel bad that you don't have a chance to figure out exactly what's wrong with the horse and be able to tell the owner exactly what's wrong before these things are done. Hello? What? Now this is a unique situation, is the company that we usually have pick up the horse or dispose of the horse can't get here right away. Now, the good news is the mare's not suffering. I mean, she could have another episode or two between now and then, but they can't get here till at least Wednesday, but they said they'd even prefer to wait till Friday. It was pretty close, huh? Wow. Drop the drugs and... We get to bring foals into the world and be there when they're first born and watch them grow up and be obviously usable horses. And then there comes the time, and what we have to keep remembering is that we have, horses are obviously domesticated animals now, so they're in our complete care, and that care is much more involved than people probably think to from day to day. And this is the typical scenario where you get to a point where what's the best for the horse? Well, the horse in a reality, in a situation where she's in the wild, she obviously wouldn't have made it this far. We're going to give her a pre-med to start with, and then the pre-med is just a sedative, and then we're going to give her 100 cc's of a euthanasia solution, which basically will stop her respiration and will stop her heart after a few minutes. And it's very humane in the sense of they really don't know what's going on, much like anesthesia type of euthanasia. The thing about euthanasia is just like anesthetizing a horse is you're taking a 1,000-pound animal and you're giving something that's going to create them to fall pretty abruptly. And so even though it seems like it's, like I said, you're humanely putting the horse down, it's still very difficult at times because they don't always go down the way you want them to. They can actually fall abnormally, fall backwards, rear up, fall down, and have an abnormal response to it. If she doesn't like your hand up there, just take your hand off of it then. Just to get her to bring her head back down here for a second. There's half the dose. There's the other half of the dose. Cap back, get that all out of the way. She's going to take a couple pretty deep breaths and hopefully go down the way you want her to. You notice her breathing is pretty well stopped. She might take what we call an agonal breath. After a few minutes, it'll be a really deep, quick, abrupt breath. But for the most part, her breathing will be pretty well stopped by the time they actually make it onto the ground. Her heart is obviously still beating though, and it'll take a few minutes for that to stop.
Dr. Newcomb, equine practitioner, contacted this lab for diagnostic assistance with a mare that had been through an episode of seizuring and had been humanely euthanized and brought to the lab for necropsy evaluation. We received the horse around 5 p.m. on Friday evening, and we logged it into the computer with a unique identifier so we could always identify the horse, and we began the necropsy examination. A necropsy examination is a post-mortem examination of an animal equivalent to an autopsy in a human. And we were particularly interested in the central nervous system, particularly the brain, because it had seizures. And we began to take the brain out immediately, and then we place that in a preservative solution so that we can always examine every part of it. The next step after the staining and the cover slipping of the sections is to have a pathologist examine the sections under the microscope to determine the nature of the process. We do have some brain here, a piece of midbrain, hindbrain, cerebral cortex, midbrain. I see no inflammation. I'm looking at this section on a low magnification. If I see something abnormal, I'll then move the magnification to a higher power. Possible causes of seizure in an old horse would include a brain tumor, a brain abscess, a viral encephalitis, for example, West Nile virus or equine encephalomyelitis, a injury from a kick to the head, a toxic plant such as yellow star thistle, and that would be about it.
The diagnosis that they have as their final diagnosis was localized area of chronic hemorrhage in the base of the brain, that basal ganglia area that was more than likely responsible for the involuntary motor activity. The etiology is the only concern, is they don't know why. They can't tell us why by the slides and looking at the tissue. And they said possibly related to trauma. There was no gross evidence of trauma. There could have been multiple other factors that could have accounted for that hemorrhage and that basal ganglion abnormality, but that we felt was the reason that the mare was showing the clinical signs that she was showing, primarily the involuntary motor activity, which in all safeness for the mare and safeness for people handling her, our decision to have the mare euthanized was definitely the best decision for everybody involved.
The previous story on Horse Vet was about the end of life. Now we come full circle to the beginning, a mare named Roquetta. Last spring, several mares at a ranch near the Pala Reservation were getting ready to give birth. The Pala Reservation is east of Interstate 15, north of San Diego. A crew from Horse Vet camped out there with a video camera, waiting up all night to try and catch a foaling. Also camping there was a veterinary technician to assist in the birth should any complications arise.
I'm Pam Glickman, and I'm an equine vet tech and horse trainer. In nature, many horses give birth, or all animals give birth in the wild pretty naturally on their own, and usually it will go quite well. But being a vet tech, I'm there to be able to spot if there is a problem. She came into the indoor arena to give birth. I imagine it would be for the warmth of the hot lights on top shining down on her. Also the soft sand that was very comfortable to lie down, and when you're pregnant, I'm sure it's that extra weight. And it was excellent for us to be able to watch this birth in full view. We have 3 that are expected anytime this week.
Let's watch as this miracle of nature unfolds for the cameras and viewers of Horse Vet. As the foal's head and front legs emerge, we see that this is a normal birth. The white covering or amniotic sac has broken over the baby's nose, and he takes his first breaths.
Three other mares walked in, surrounded her, and watched the foaling. Well, they did that to protect the mare and foal from any coyotes that might come. and possibly just for interest's sake to see such a beautiful birthing happen.
The birth sac, umbilical cord, and placenta are pulled out of the birth canal and drop onto the sand. Later, Pamela will check to be sure that all of the afterbirth parts are out of the mother's body.
After the foal is born and I see it's breathing well, I will collect up the afterbirth and put it into a bucket and rinse it off. And I will save it for a later time to make sure that the mucus plug and both horns have been passed. If it isn't passed, the mare can get quite toxic from it and it can cause a lot of problems. So I will spread it out at a later time and make sure that all the parts are there.
Dawn is coming, and although it has been a long night, the birth of Raqueta's foal is very smooth and without any complications. It is important that the baby gets up on its feet soon after birth and begins to nurse. The foal makes several attempts within the first hour of birth. Finally, he is up, and although a bit unsteady, it is an excellent sign that this newborn foal has healthy legs to stand upon.
Watching a baby horse when it starts to stand is like watching Bambi. It's unbelievably the cutest thing. They stand up, they fall down, they're in this wide spread position with their legs trying to balance themselves, and it's so much fun to watch, and that's where it's so nice if there is a soft landing for them to fall.
Now the bonding between mother and baby can continue. Nursing mother's milk contains a substance called colostrum.
Colostrum means first milk. Colostrum contains lots of immunoglobulins which will help the foal fight bacteria and viruses. It must receive this milk in the first 24 hours. I usually will collect from the mare 50 cc's of the colostrum that we will keep in a container and store it in case we ever have an orphan foal. After the foal is standing and has nursed and is in good shape, we give an intramuscular shot of tetanus, intramuscular shot of vitamin A, D, and E, and then we give the probias orally, which is to help gut mobility. I fill a shot glass with some iodine. I use it to dip the umbilical cord into the iodine. It's antibacterial, which will prevent infection. When a human gives birth, we quickly are rushed to the hospital. We are put into a white room, or people are all standing around. Nothing is done naturally. Epidurals are given to be able to watch a foaling and watch everything be so natural. In the middle of the night, they wait till everything is quiet, and just to watch everything, just to be patient and to sit back and let nature take its course, and to see the baby being born, standing up on its own. It all takes a lot of time. Nothing is in a rush. And they start to walk, they start to nurse, and everything is so natural.
Raqueta and her foal are a part of the circle of life that veterinarians and technicians encounter in the episodes of Horse Vet.
Wally was diagnosed with equine motor neuron disease, and there's no known cause or cure. So I brought him here for research, I guess, to try to help the next horse.
And how old is Wally?
He's 13.
You've had him ever since he foaled? Or?
No, I've had him about 4 years.
Mm-hmm. And how do you use Wally?
We used to ride him. I had bought him for my kids to show, and he colicked about 6 weeks after we bought him and had to have major surgery, so he ended up being my horse. And while he was healthy enough, I used to show him some and take him, mostly trail ride on him. But he hasn't been rideable for a while. The symptoms of this particular thing started about October, and it kind of came on really suddenly. One day I turned him out when I went to get him to put him back in his stall. He was trembling, almost like he was cold, so I put a blanket on him. And this next day he was still shaking a little bit, not that much, just a little bit, almost like shivering. And so I took him back to Chino Valley Equine because it didn't seem normal. They did a bunch of tests. They tested him for West Nile virus and EPM, a bunch of things, and he just got progressively worse with his shaking, and he holds his head down really low. The symptoms just kept getting worse. They put him on vitamin E and steroids, and it didn't seem to help at all.
He's taking a lot of weight. He's very weak in his neck. Apparently, in his stall, he rests his head on the stall door for hours on end, as though he's very weak in his neck. It's a degenerative disease of the central nervous system, and the cause is unknown, and it is called lower motor neuron disease. That is the clinical diagnosis. There has been a muscle biopsy looked at by us and at Cornell University and in Oregon State University, and the consensus is that it is lower motor neuron disease, which is a disease almost like Lou Gehrig's disease of man. It's very, very similar. And Lou Gehrig's disease, of course, I think it has a genetic basis, but we don't understand this disease, and that's why we want to do a good job on it.
It develops over a long period of time. We know it's related to vitamin E and selenium deficiency, though I don't think it's been definitely proved. And basically this is what you see. The animal is weak and loses condition and is a shaker.
We call that muscle fasciculation or tremor. It's an involuntary movement. She can't help that. He can't help that. So we just got to take some blood samples and then we'll...
Yeah, I thought we should do some enzymes, CPK. Yeah.
Catalina has a paralyzed cartilage. It's called arachnoid cartilage in her throat, and that every time the horse inhales opens up like this, and then when they exhale they go flat and close. So they should be doing this. In her case, the left side is not moving and stays flat down like this, so she's only working with half of her airway. So what we're gonna do, is going to go through the side of her neck and create a prosthesis that is going to pull this cartilage open. So she's always going to have that. It's called an abduction or partially open. So she's going to be able to do this, and now she's always going to have a full airway. Since she's a performance horse, she has to have the ability to get as much air as she needs to for big jumps. Otherwise, that is definitely going to be a limiting athletic career.